Hey, so welcome. My name's Joanne Boyle. I'm Head of Engagement and I work with the Digital Health and Care Innovation Centre in Scotland. We are based in Glasgow and we are the National Innovation Centre for Digital Health across Scotland. And 2 years ago, the Scottish Government commissioned us to set up a digital mental health and innovation cluster. And that innovation cluster is really around managing an infrastructure that supports upscaling of digital innovation, but also to share best practice, to exchange knowledge, and to coordinate all of the innovation activity that's happening across Scotland. We also have a virtual resource, and the QR code is on my virtual background, which you can see. That QR code will take you straight into our webpage, and on that virtual resource, there is a number of reports and articles and all recordings of every single digital mental health innovation cluster meeting that we've had. And we have over 1,300 members from academic, business and civic sectors. And we're really set up, and part of the reason that we want to do this podcast is to work beyond Scotland, beyond the UK, and to work with our global partners. And DHI, the National Innovation Centre for Digital Health, works very closely with the ECHAlliance. And that enables us to link with 80 ecosystems and over 1,100 partners that the ECHAlliance actually has. So when ECHAlliance approached us and asked us to do a podcast, we were absolutely delighted because that helped extend our reach and let people know beyond Scotland and the UK around the excellent work that's happening within the Digital Mental Health Innovation Cluster. What I wanted to do was briefly introduce you to the people that are going to share all of that excellent innovation that's happening in Scotland. And with us today, we have Chris Wright, who's the National Advisor for Digital Mental Health in Scottish Government and also leads the Digital Mental Health Programme. We have Nagore Penades, Consultant Psychiatrist, who works in Glasgow and is also the West of Scotland Clinical Mental Health Innovation Lead. And we have Emma Fowler-Stewart, who's with us as a consultant psychiatrist who is the Clinical Digital Therapy Lead in Scotland, and Andy Bleaden from the European Care Health Connector. So could we have Andy, do you want to just say a few words around the work that the ECHAlliance actually does?
I will, and I'll be very brief. So as Joanne said, my name's Andy Bleaden. I work for the ECHAlliance. We're the Global Health Connector. And my only intention today is to expose what's happening in Scotland and the fantastic work around mental health in Scotland to the rest of our community, because many of our members are closely involved in the work of mental health, whether that's in the US, Europe, Africa, India, Australasia, or in Singapore. But for them, we always want, as a connector, we do four things. We connect people, we convene them together like this, we amplify what happens in different countries, and we accelerate innovation. And we want to accelerate the adoption of innovation in Scotland because we see fantastic examples with DHI, who run not just one cluster, a number of clusters, which are, I think, worth paying attention to for the rest of our community. And certainly the mental health cluster, and I invite you again to scan that code and find out more about it, is one of those. What the ultimate aim of this is to make connections, because, and I'll be asking this question later, this is all great, but so what? Let's see where we can do some collaboration, because there'll be ideas here today that the listeners to this and the viewers of this will be able to think, yeah, that's interesting. I want to find out more about what Chris is doing, or Nagore or Emma's doing. And to actually do something, because I've spent too long in the mental health world. I've listened to people talking about doing stuff, and I'm a bit bored. I've rather got on and do stuff. So hopefully today, let's look at where the opportunities are to do stuff. Back to you, Joanne.
Hey, thanks, Andy. That's great and really helpful, and sets the scene as to why we're actually working together and why we're doing this podcast today. So, Chris, if I could invite you as the National Advisor for Digital Mental Health and Programme Lead to just give a bit of an overview of the strategy and some of the priorities and what you're looking at within the Digital Mental Health Programme, that would be great. Thank you.
Thanks, Joanna. Thanks, Andy. Yeah, so just as a way of introduction, so yeah, I am Chris Wright and I work in Scottish Government, but my background is NHS healthcare in Scotland. And I started working in the field of digital mental health in 2002. So a very long time, 22 years. And in my 22 years, I've seen a massive transformation of mental health services and psychology services, really with the introduction of digital, and particularly in the last 4 to 5 years. So even pre-COVID, we began seeing a real shift towards a digital approach. And this has really been accepted and emphasised within the new National Mental Health Strategy in Scotland. The strategy was launched in June 2023. It's been one of many strategies, but it's the first strategy that really I've seen that has a true integration of digital into policy in mental health, and digital being represented as an integral part of how we're delivering mental health services across the whole of Scotland. This is obviously personally very pleasing to me, but I think really important in the context of how we're delivering digital. And it's that integration which is really, really key. So we're now in a position where digital is not an add-on or is not a kind of side part of what we do. It is an integrated part of delivery. And as a consequence, the strategy is beginning to look at a whole range of different opportunities within the digital areas. The strategy, I think, is a really ambitious strategy in Scotland. It covers a lot of areas, but I think the most significant change, I think, within the strategy is this move to much more social aspects of mental health. So moving away slightly from more traditional terms of delivery, but into a much more social economic area, and looking much more at prevention and self-management as the way to move the mental health forwards in Scotland. This is obviously in relation to a population approach. And the strategy focuses on 3 Ps. So there's prevent, promote, and provide. And those 3 Ps really are the cornerstone of how we're going to begin to approach mental health services and delivery in the future. And as I said, with digital an integral part of that moving forward. I think in Scotland we're seeing, as we are almost everywhere, massive budget pressures with the cost of living crisis and a whole range of other consequences of COVID and various different global activities. But I think actually budget pressures give us opportunity within digital. We need to transform how we deliver services. And as a consequence, then we begin to find opportunities in terms of how we're delivering and changing what we're doing at a local and national level. But it's really important that we always see digital as a choice. And I think that's represented within our policy in Scotland, that we have to continue to develop our traditional face-to-face approaches or group therapy approaches, develop our nursing and psychiatry capability in Scotland at the same rate that we're developing our digital, so that people always have a choice of how they access their mental health services and support in the future. As part of the kind of key delivery aspect in Scotland, we have a digital mental health programme which was established very early in 2021. But the digital mental health programme was basically a consequence of lots of activity over many, many years. And most of us on the call today have been involved in digital mental health in some degree for many years. And really what it was the kind of articulation of a need within Scotland, which really began to create a much greater sense of cohesion around about what we're trying to do, much greater collaboration and coordination of what we're doing, and really looking at how do we deliver digital at scale on a national level at a high quality. And the quality was really, really key, I think, in everything that we do in Scotland. The mental health programme has 6 kind of core work streams. So we look at digital services, which is by far the bulk of what we do, but we also look at innovation, hence the innovation cluster, evaluation, equalities and inclusion, workforce, and data and infrastructure. And it's really through those 6 different work streams that we're beginning to build the ecosystem or the infrastructure, which will be sustainable longer term for the delivery of digital mental health in Scotland. Across our digital services work, we focus on 4 key areas. So we have digital therapies, and Emma will be talking about that later on in this conversation. But it's interesting because where we are now in Scotland is we have about 35 different digital treatments that are available nationally. So that's available in every single region. And we have 14 territorial health boards in Scotland. And we received around about 74,000 referrals last year. And just to put that in context, that's the equivalent of psychology services in Scotland. So for now, every 2 referrals to a psychology service, 1 will be to a digital treatment. which is a significant milestone for us in Scotland. Across other work, we have video-enabled therapy, which is obviously therapy delivered through video, both in terms of face-to-face or one-to-one, but also as groups, which is a really exciting development in Scotland and giving us much greater capability as we move forward. We also focus on remote monitoring, and this is a relatively new development in Scotland. So we have a remote monitoring platform, which is nationally available, and we're beginning to build capability into that platform to collect clinical outcome data and a whole range of other information. But more of that's building for the future and giving us capability where we'll be able to develop a whole range of remote monitoring capabilities across the whole of the country in the future, including things like wearables and various other different aspects of that. And the last piece of work that we really focus on is self-management and prevention. And this is really looking at the wider landscape online, as well as apps specifically for mental health and self-management. But what we're finding with self-management is an incredibly complex piece of work. There's so many different needs and requirements for individuals, and we have to be ensuring that we're meeting those needs moving forward digitally. Also, as you can imagine, integration of self-management into standard service or traditional service approaches is complex in terms of what we're trying to achieve. I think the rewards are there for that bit of work, but ultimately we have to make I guess we have to be quite practical in terms of how long it will take to really embed those approaches into our services. And what we've always strived to do across Scotland is really focus on ambition in our digital. We don't tend to look at small pilots, but really look at how can we upscale our digital capability. And as a consequence, we've really taken a service model approach as opposed to a technical approach. And this has been really, really key, because what we're doing is we're building services ultimately for people to engage with and to use, regardless of what it is. And as a consequence, what we're finding is we're able to have much better clinical engagement, much better engagement with wider services and social care, for example. And ultimately what we're able to do is work much more collaboratively to build large-scale services across Scotland. And looking at consistency and approach around things like procurement and purchasing of technologies, but also making sure that what we're doing is of a high quality. And at the core of that is ultimately shared learning and a shared learning approach, where we're ensuring that we're communicating with each other as well as the wider areas outside of Scotland, and really learning as much as we can about what does good look like and what does best practice look like. So really, really important that we're focusing on ambition, but also ambition with purpose. And the purpose ultimately is to ensure that individuals who are struggling with their mental health have access to the right treatments and the right support moving forward. And that's really been core to everything I've done for the last 20 years, but certainly core to the Scottish approach for digital mental health. In addition to that, what we're also beginning to look at really is how do we sustain digital in mental health. And I think this is a particular challenge to health and care settings. And as a consequence, we have to be very mindful in the sustainability work we do that it cannot be limited to business as usual, or to introducing technologies and letting them sit and do their jobs. We have to build sustainability that allows growth and development. And that's why innovation is so important. And we know there's many new technologies coming through that will replace their existing technologies. And it's important that those technologies are brought in to health and care settings in the right way, ultimately. And I'm sure Nagore will pick up on that as we have that conversation. But what's really important around sustainability is ensuring that whatever we do is actually integrated and embedded, not just within our service delivery, but also within our workforce development, in our innovation activities, in the evidence we gather about the services we create, in the data we're asking our patients for, and a whole range of different aspects of that. And as a consequence, in Scotland, we've developed a sustainability framework which looks at 6 or 7 key aspects or 7 domains. Right at the top is leadership and governance, and right the way through to ensuring that our service delivery is consistent and, again, of high quality. I think what's been key on certainly the journey I've taken with digital mental health, and as a consequence probably the Scottish journey to many respects, is really those collaborations and those partnerships we create and they're absolutely core to everything that we've done. And this group of individuals on this call is a really good example of parts of those collaborations where we all have different skills, different capabilities, and it's actually how do you maximize those skills, experiences of the individuals you're working with. And again, partnership has been a really core aspect of what we've done. We've continued to have strong partnerships with European countries, for example, through our EU projects. We maintain strong connections with our UK partners in relation to the other nations, but also other organisations that we work with. We stay very strongly aligned to our suppliers to ensure that we're working together to achieve something greater than the sum of our parts. So it's very important that what we're able to do is to continue that learning journey and that the growth of digital mental health through those partnerships and collaborations, which is why these kind of podcasts or events like this are so important, because the more we can learn, the better we can deliver ultimately. Thank you, John.
That's brilliant, Chris. Thank you. And I think you made so many salient points there that I'm sure with the beauty of podcasts and is the ability to be able to rewind and listen to and take some of those notes down. But the one thing that really struck me, and I think this is true of many areas, is you mentioned about the budget restrictions and the limitations, but you also flipped that over and said that provided opportunities. Is there an example that you can maybe give that brings that to life?
I think one of the things that we've had to do probably in the last 18 months or so is begin to look at our existing technologies and the opportunities around about that. And I think one of the accusations you can have of digital is they're constantly purchasing and implementing new technologies without really maximizing what they have currently. So one of the pieces of work that we started recently was really looking at how do we use our video enabled capability to begin to create more equality around the services that we offer. An example of that is the delivery of groups, but across our territorial borders. So we're now in a position where we have the technology and the capability to deliver groups from any part of the country, and anyone in the country can then attend. And we know in certain parts of Scotland, which are very remote and rural, but also very small populations, they have limited access to specialties. They have limited access to the kind of level of clinical care and support that you may get in a Glasgow, for example. And actually technology is one of the key ways you can overcome that. So what we've looked at is we've looked at existing technology that we know has been rolled out, we know works really, really well, but actually just using it in a slightly more transformational way. But the consequences of that could be much greater efficiencies of delivery for bigger boards like our NHS Glasgow, but also access to services for individuals who are working or living in very remote rural areas who just wouldn't be able to access those services normally. And I think as a consequence of budget restrictions, it makes you think in a much more innovative way and a much more thoughtful way. And ultimately, what we tend to find is the foundations you build when you're in budget restraints actually are the foundations that stay longer term, because you put a lot more thought into how it works and how it operates. So I think there's huge opportunities, not just for digital to flex its digital muscle, as it were, but ultimately to look at different service models and different service approaches in using digital. But the first thing I would always do is look at what you currently have and work out the best way to move forward with it.
Thanks, Chris. I think that's really helpful, and certainly for our listeners to understand the variation perhaps in the regional areas within Scotland and access to services, and understanding how far people sometimes have to travel up to 500 miles and back if they're living on islands or very remote areas in Scotland. So I think that's incredibly helpful. Andy, you looked like you wanted to come in with a question.
I always think with this is great. And I'm glad to hear that you're collaborating outside of Scotland, both within the UK and beyond. What do you want in terms of partners? Are you looking for new technology providers? Are you looking for research partners or patient organizations? What do you need?
I think I'm pretty greedy. I want all of that and a wee bit more, actually. I think the reality is, if you look at the different aspects of what we need within digital, we need strong evidence, we need strong research, we need to understand the genuine value of digital within mental health. And I think even in my 20 years working, I think we've only scratched the surface. So developing a greater understanding of what digital does and how it transforms people's lives and how it can be applied is really, really important. I think we're looking for really innovative ways of delivering digital and actually the impact of digital. So we know there's so many good examples of how people are using technology, perhaps virtual reality or AI in different settings. And I think it's fair to say that we need to have a much stronger emphasis on new and emerging technologies in Scotland. So we have lots of technology, but it's old technology. So really understanding how the new technologies are going to work and are going to change how we do things is really, really important, I think.
And who's getting it right? Because that's the other thing. Because I always think this is great and Scotland's great, but who's getting it? Who are you jealous of?
I think Scotland is great. I was going to say that first, but I think we've done amazing things. But I think there's really fantastic pockets across lots of different areas. So Denmark, for example, have a really good government structure now working with digital, which is very integrated and very advanced. You have some really good technology coming out of innovation. In different parts of our country, there's some fantastic XR or extended reality examples within the UK, which are really changing things. We now have AI triage, for example, working in England and parts of England, working really, really well. But then I think, if you're going further afield, places like Australia, New Zealand, and Canada in particular, are really looking at the strategy side of things and actually how do you bolster strategy capabilities from a government side right through to service delivery. So I think there's pockets of good work happening all across the globe. I guess the challenge is beginning to pick those areas which actually, I suspect what would happen is if you pick all of them, you get one complete picture. And I don't think anyone's doing the complete picture at this point in time.
That's great, thank you. So, Nagore, can I ask you to explain a little bit about the work that you do in the West Regional Hub?
Yes, thank you, Joanne. So as Joanne said earlier on, I'm a clinician, I'm a psychiatrist, and I have this other role as clinical lead for mental health within the West Innovation Hub for Scotland. So just for those who are not familiar, and I gather there will be lots of you, I wanted to explain what an innovation hub is. It seems to be a vague concept that lots of people struggle with, but if you can think of it as a center that offers both clinical, academic, and technical expertise and support for people that want to get involved in innovation or people who are already involved in innovation. And what can a hub do? Sometimes if you think about what something can do or cannot do, it's easier to understand what they are. So what an innovation hub in Scotland can do is give you access to NHS infrastructure. Not only access to clinical infrastructure and the patients, but also to the e-health technical knowledge of the health system, the digital infrastructure, the data, and almost most importantly, the access to the governments and the access to knowing what you need to do in order to be able to implement anything that may come out of your innovation. Because at the end of the day, any innovator wants to come up with, let's call it a product or a solution that can be implemented because it has got all those elements, got the technical validity, has got the clinical proven efficacy, but also has got the governance and ethics approvals to go with it. So a hub can help you navigate all that and offer you the support. And we do that by supporting people at different stages. So another question that we get asked very often is, but who is the hub for? And I guess the hub is for everybody. So we'll get approaches from clinicians that say, I work in this area. It could be I work in psychiatric inpatients area and I got this problem and I would like to find a solution. I got a few ideas, but I don't know where I can take them. So the hub can support them formulate that problem and look at solutions. We could have approaches from somebody who is working on a digital platform or a digital product or technology that's in its infancy, and they want to look at, is this something that could be developed further? Is that something that could solve a problem for the health service? So the Innovation Hub can support people at different stages and coming from different angles. So having said that, we welcome any approaches, and I'm sure Joanne will kind of offer you the contacts as to how to contact Innovation Hubs. But let me tell you a little bit more about my role and mental health innovation in general. So when we started looking at mental health innovation within the West region, and that is Glasgow and the surrounding areas, and bear in mind there are 3 innovation hubs in Scotland, what we started to do was to look at how we could look at what is needed in the clinical areas. Where are the signals coming from? Where is the need coming from? And how could we start looking at those, should we say, hot points, problem areas, and start looking at perhaps solutions in the innovation arena? And what we realized was that those signals were coming from every single angle in the mental health arena. And by that, I mean, we had signals coming from the population in general. Mental well-being has been something that has been at the forefront of not only the government, not only the health service, but the population's mind over the last, I think it's fair to say, decade. And then since that thing called COVID came along, it has been a big, big worry for lots of people. So we had that, the first P, the prevent, the how do we put well-being resources out there? So we started looking at a solution to that. And one thing that we realize is it's not for lack of resources. There's lots and lots of digital resources accessible to everybody, some of them for free, some of them at a cost. But how does an individual that is worrying about their mental health but has no health background or has no knowledge, know what is trustworthy, how do they know how to navigate that very, very difficult, almost a rabbit hole that you can take yourself down to? So we started looking at how we could, within the Innovation Hub and collaborating with DHI, create something that allows us to have some kind of quality assured NHS stamped library of supported self-management resources. And one of the first things that we developed within the mental health team in the west of Scotland was an app called My App, My Mental Health. And as I said, it's a library of supported self-management resources that a group of senior clinicians have a quality assured as trustworthy at 0 cost. And it's fair to say that most of those resources have already been vetted by the Scottish government, have already got the licenses for Scottish citizens to use. So the quality assurance was already done. And what we have done is put them all in the one place, in the one library. So people have got assurance that what they are accessing to support their mental health and well-being is a good resource. Then moving on from where else we found signals, we realized that at the other end, our inpatient, mental health inpatient services were really, really struggling. So we know that the provision of beds is lower than it has been for a long time. The demand is high. And we also know that there have been some concerns about staffing over the last few years, staffing shortages, burnout. So we started looking at how could innovation help our colleagues within the mental health inpatient family. And Chris already touched a bit on remote monitoring. And when we hear about remote monitoring, we I think most people think about wearables and our watch telling us about our heart rate, things like that. But there is more to remote monitoring. So we started looking at how could almost our hospitals start to look different. How can innovation be part of our infrastructure, starting from the brick and mortar, the walls? How can we change things? And I think I need to say this, we are in our total infancy. Is an embryonic idea, but we know technologies are there. We know that what we are missing is that link between the technology that is being used in other, let's say, industries. The need in health is there. I think we are starting to understand the capabilities and how that could translate to making our hospitals slightly different. So that's the other extreme, and another theme that is coming from the West that we are hoping to explore fairly soon. But I can tell you that it's very early, but hopefully with the maturity of the technology that we see in other areas, we'll be able to progress that with the help of the Innovation Hub. And then in between, what we realize is that there are many, many areas within mental health services, never mind many pathology areas that could benefit from innovation. But we wanted to focus on an area that could be almost like an umbrella solution for lots of things and lots of pathology areas. And that is the area of data visualization. I think this will be a problem that translates to many health services or even public sector. We have got lots and lots of digital systems that we navigate every day. And I, as a clinician, I often like describing how when a clinician goes into their clinic and starts the clinic, they often have to start up to 4 different records for the one patient. So for example, they could have their mental health notes in the one system, their blood results in another system, the results of their scan in another system, and the notes from the GP maybe in another system. And in order to give a good advice and good care, have a good understanding of that patient's needs, they need to access those 4 systems. And we felt that that was an area that many of my colleagues in mental health and in other areas were suffering from. And I say suffering because a lot of the time there will be consultations that are not as complete as they can be because one of those data systems is not updated or is not uploading or is not available at the time of consultation. So we started looking at the possibility of developing wireframes that will somehow digest the data and present it to the clinician at patient level. So this is the idea that when you see Mr. McDonald, we are here in Scotland, so let's go for a McDonald, Mr. McDonald, you will be able to go to the dashboard and the page for Mr. McDonald, and the system in the background will be able to pull the data from the 4 or 5 different pods of information, and what you will see is the main picture for Mr. McDonald in the one screen, giving you the latest mental health problems with the latest blood results, the scan results, and what the GP found the last time they saw them. That is the ambition. That's what we are working on, and we are starting to make some progress with that kind of innovation in some areas. And the other layer that we would like to add to that is that we would like patients to be able to communicate with us digitally, to have a patient-facing platform in which, for example, if we needed any rating scales or we needed any information from patients, they could digitally send that to us, and it will be added to their, as I said, dashboard or their patient page. So those are 3 areas within the West that we are working on in mental health innovation. The last thing I wanted to touch on is the drug death prevention innovation that we are working on. Sadly, this is very much a Scottish problem, although it happens in many other countries. But sadly, the rates of drug deaths in Scotland are really high. So we have been looking at innovation solutions for prevention of drug deaths. And within the West Innovation Hub, we have been looking at remote monitoring technologies that could alert to the overdose happening in order for us to prevent that. Again, this is a technology that seems to be very capable, has been used in other areas, but not in health. And what we are hoping to do is, with the infrastructure of the Innovation Hub, to bring that slightly mature, I say slightly because it's not fully mature technology, into the health territory and be able to come up with a product, a solution that can meet the demand that is high. So that's a bit of a very quick tour of what we are trying to do, but hopefully it gives you the main things of that we are working on within the West.
Thank you, Nagore. That gave a brilliant overview of the examples, and I think it really helped bring those to life and to help people understand some of the solutions that you're looking at and why. I think for our listeners, it might be really helpful. You described signals and you said that signals came from all angles. And if people are starting off at that point and listening to those signals, what methodology or how did you actually then prioritize those signals and know which ones to actually choose or focus upon?
So I wish I could say that we were able to take all those signals forwards and find a solution to, but a lot of the time it's about resources. Sadly, that's the case. So I think a good example is the signal from the inpatient services. So that came up, as I said, I'm a clinician. I meet with my clinician colleagues, and every clinical meeting I was going to was highlighting that the inpatient services were struggling, not only in Glasgow, not only in the West. I think it became a Scottish problem. So I started inquiring a bit more formally around that. Okay, I hear the noise, but what is exactly that is happening? Is it that the patient population is changing? Is it just a staffing thing? So we started trying to understand the problem, and the problem is very complex. I'm not going to try to make it, a single problem, but what it was very clear was that that was an area where if we were able to ease a bit of the pressure, the impact could be quite big, because it wasn't just in the one corner, it was quite global, at least within Scotland. So I started working with the Mental Welfare Commission, trying to understand, because a lot of our inpatients are under the Mental Health Act here in Scotland. So we engaged the Mental Welfare Commission, trying to understand what will be acceptable ethically with regards to how we can use remote monitoring, what will not be acceptable, and then start looking at what solutions are out there, and start working on that. We have had other approaches from people saying, I work in this particular area and I would like to develop this particular app for this particular problem. Ideally, I would like to be able to say yes to all of that, but if something comes from a very small area and is going to have a very small impact in a small group of people, and we don't have the resources, sadly, we need to focus on those solutions that are going to have a wider impact, at least until we don't have any restriction of resources and we can listen to all those signals. But I can openly say we listen to all the signals. We may disappoint people and say, oh, I'm really sorry, I don't think I can prioritize that right now. But certainly, I always say to people, if you would like to highlight a problem area, or you think there is something within your clinical area, I always encourage colleagues to come and speak to me, because if I don't hear the signal, then how can I start thinking of what is needed?
You're on mute, John.
Sorry, I realised that what you've just described is listening to the signal, but then also exploring a little bit wider to understand if that's an issue in other areas and working with other partner organisations, which again is reinforcing the entire message of this podcast today, that we are not working in isolation. We are working with our partners to have that fuller understanding and evidence base. Andy, you looked like you wanted to come in with a question, or?
It's just some information, because obviously we get a view of mental health services outside of Glasgow, outside of Scotland, outside of the UK, outside of Europe. And what I'm always keen is to make some connections with not traditional Western approaches around psychiatry or psychology, but to go to those countries where they don't have hospitals, they certainly don't have psychiatric units. The numbers of psychologists across Africa might be maybe 6,000 across the whole continent, 54 countries, or psychiatrists, etc. So what do they do? What do they do in a resource restricted environment that we could learn from? So where are they using community support, volunteer support, whether it's granny benches in Uganda, or whole different approaches to dealing with people who have been through, say, trauma because of war in Ukraine, or in how can we plug into those and learn about some of the tools, digital tools that they've had to introduce, not after piloting for 3 years, but now, because they've got victims of war, victims of or refugees in our ecosystems in Turkey. What can we learn from them? I think that's the importance, to try and think, we've got a lot of information to share from Scotland, but also we can bring in best practice too, not just from the west of Europe, but outside of Europe too.
That's great. Thanks, Andy. Emma, can I invite you to describe a little bit about the work that you're doing in digital therapies, please?
Sure, thank you, Joanne. So I'm Emma, and I'm a consultant clinical psychologist, and I'm also the clinical lead of the digital therapies team in Glasgow. And I also input into the peripatetic digital psychological therapies team, also in Glasgow. I think within Glasgow, we've been very keen on harnessing the benefits and the opportunities that come with some of the kind of digital interventions, innovations that Nagore and Chris kind of highlighted earlier, and I suppose matching them with the kind of framework and the vision from Scottish Government. So within Glasgow, there's an established, what we term our digital family within kind of psychology, and there's 3 branches to that. So we have our digital therapies team, we've got our peripatetic digital psychological therapies team, and we also have the group service as well. So all 3 of those teams harness kind of digital technologies to support people, I suppose, in Glasgow access psychological interventions. They do it in slightly different ways. I can't talk too much about the group service just because I don't work there, but for the other 2, I do work in there, so I can talk a bit more about them. Within the digital therapy service, so within our team, we provide online digital interventions for a wide range of mental health difficulties. So that's provided through a kind of online platform. So people log on, go through it their own pace, their own time. They can do it at the convenience of their own homes. They could do it on their mobile phones. They could do it on their tablets, laptops, whatever they find most beneficial to use. And basically log on, they work through these programs, different modules. The modules are very interactive. So there's things like videos there that they can watch. There's different tools where they can learn about different kind of psychological models and things through. They can leave journal kind of entries where they can kind of type how they're feeling and how they're relating to the content that's provided. There's animations, so there's questionnaires, so they can kind of just tap into maybe some of the things that were mentioned before about that self-monitoring. So they'll be able to kind of see how they are progressing as they're working through these modules. So we provide those, and we also support them to access those. We support them and encourage them to engage with them. So when people are referred to our service, and we get about a third to that service in particular, we get about a third of all psychology referrals come kind of via our digital therapies team. Usually from GPs, although we've partnered with other kind of services as well. And when they are referred, usually within 48 hours, which is kind of unheard of within psychology services, sadly, just because of the wait times and such. Within usually around 48 hours, somebody from the team will phone them and will explain to them, you've been referred by your GP to this online program. They'll explain a bit more about what the program involves. They will help with any kind of technical issues, as in kind of this is where you can download it. You can download an app. You can go on via kind of the web browser. So they'll help them just kind of get set up. And then the other important part to the intervention is that everybody will receive reviews. So we call them kind of supporter reviews. So they've got a supporter, dedicated supporter throughout their time doing it. And those supporters will look at kind of the modules they've covered. They'll see if there's any comments that's been left, and they will give feedback. They'll motivate, encourage them. So this isn't, they don't provide clinical kind of support, because the intervention is the modules themselves, but they do provide that support. They can unlock additional modules for them. So for example, if somebody has written in one of their journals that they're having difficulties with sleep, then one of the supporters can go in, read that, and then write back to them and say, oh, I noticed you had difficulty with sleep. Why don't I unlock the sleep module? And you can work through that. We encourage people to log on every day. You can do it for a short period of time, and kind of work through that. We also within the team have a remit of promoting the kind of unsupported interventions as well. So throughout Scotland, people have access to a number of different kind of self-help resources, and we promote those, encourage people to use them. And the other, I suppose, part of it as well is promoting it to clinicians and promoting it to other kind of members of staff who themselves may be a bit unsure about digital technologies. Some people are quite suspicious of them, which could then hinder the public's perception of digital technologies if the person you're talking to isn't so keen on them. So I suppose it's just to support staff and kind of give them a bit of an insight and show that, you know, it can be trustworthy. You know, digital doesn't need to be an enemy, especially I think a lot of people have had bad experiences of web bots and things like that through kind of customer experiences. So to show them this is actually different and there are humans behind, although we're using the technology is not using us. We are utilising that just to support an intervention, and ultimately it's a choice for people. So it's similar to what Chris had said earlier. We're always very keen to let people know that it is a choice, and that ultimately, you know, if digital's not for them, that's okay. But there is that option. And I suppose the next step for us is to support people who would like to engage in digital therapies. So the programs that I've described, but perhaps aren't able to due to maybe not kind of having the technology available, due to not having the confidence in using the technology. So that's our kind of next thoughts, is how can we work with people to help them be able to access these digital technologies if they would like to. So that's the kind of digital therapies team. The other team that I work for is the peripatetic digital psychological therapies team. And this is a relatively new team, and it covers the whole of Glasgow. So it was established in April last year, April 2023. And basically the aim of this team is to support other teams who maybe have long waits for people wanting to access psychological therapies. And basically within this team, we see people via kind of online video conferencing. So we will see people who have been referred, and we'll see them online. But we'll target kind of teams that maybe have long waits. So some of the primary mental health care teams, for example. Recently, we have been partnering with the trauma service, which has seen quite lengthy waits. And again, it's that options. So it's people don't have to engage online with us. They can still see a clinician face to face. But should they wish to, that it suits them, and for a lot of the people we see, it does suit them because they're able to, they don't have to come to a clinic, they can sit at home. There's a lot of interactive, we can send them things as we're speaking online. There's lots of stuff that we can do when we do see people, and we are able to provide all the similar therapies that would be provided face to face. So within the team, we've got clinical psychologists and clinical associates in applied psychology, who are able to deliver kind of cognitive behavioural therapies, acceptance and commitment therapies, EMDR, just the whole kind of range that you would find in your traditional face-to-face settings. We can provide that for people throughout Glasgow, and target those teams, as I said, that perhaps have those longer waits. So since inception last year, we've seen over 100 people, and those people would have been on considerably long wait lists. The feedbacks were very keen as well. I think for both teams, actually, the digital therapies team and the peripatetic team were both very keen on ensuring that kind of what we do is evaluated, it is evidence-based. So the evaluations that we've done so far have been relatively positive. Most of it's been positive. Before somebody sees us, we have a digital navigation session with them just to check that actually this is going to work for them when they're seeing us for therapy, that actually they're okay. They've got a quiet place in their house, they've got access to digital means, they can, they can access the internet, all of that. So we would spend the kind of first session with them, just helping get them set up, troubleshoot, I suppose, any barriers that they might have, any concerns that they might have, give them a bit of insight into what it might look like, an overview of what that's going to be like, and then we would start the usual kind of therapy process with them. Within kind of therapy, I think a lot of people think it's just going to be the exact same, but there are a couple of things to keep in mind that the research is showing us, which includes things like when people are being seen digitally, there's a kind of disinhibition effect where people can share things a bit quicker. So if you're working maybe with somebody who's experienced trauma in a traditional face-to-face setting, it might take them a little bit longer just to kind of discuss that, whereas digital, it seems to kind of cut through that, and they may share that a bit quicker, but afterwards might feel quite vulnerable about doing that so soon. So again, it's just to kind of put people's, kind of discuss that with them when they start. You see, what people have found is that sometimes, people can feel, for whatever reason, feel more comfortable and just share, but afterwards might not feel as comfortable at that. So again, just to kind of put their minds at ease that it's okay to take our time. It's the same as when we're sitting in a room. There's benefits as well of having the digital interventions, in that you can kind of share things live with them, so they can fill out kind of diaries. You can have that on the screen, you can look through it together, you can highlight bits together that might be kind of more innovative. You can show them kind of videos and things like that might help just clarify some of the concepts that we're discussing within the sessions. And as I said, the feedback we've had so far has been fairly positive to the interventions, and we've not really had anybody say that they feel disadvantaged that they've been seen digitally. The other area that I suppose within our digital family is the group service as well, but can't say too much about that just because I don't work within that service. But again, they've had really positive results. So they run groups throughout the whole of Glasgow, and see people throughout the whole of Glasgow that it might have been more difficult to do if they had just been within their own kind of cluster within Glasgow. And I suppose overall, the services as well. Another benefit of digital working is for staff, because we can have trainees in one of our digital family service, and they are able to input into one of the other digital family services as well. And I think even just for staff's confidence with digital technologies, to keep championing that as well. The health board and Scotland in general has been very supportive of staff. So there's things like the digital leadership programme, which I myself have finished quite recently, which has just been really amazing to help just, I suppose, cement some of those ideas of how to apply digital technologies to a kind of clinical setting, and how to promote those as well, and to have that dedicated time and space to kind of do that, rather than it just being a kind of within your whole every day. You're kind of got a half hour where there's maybe an article about digital, and you think, well, that might be interesting. Whereas with this, having a dedicated course to actually sit and take that time and think, how can we apply that in our setting? And I think within the settings I work, it's a bit easier because digital's in our title, but certainly for other settings as well, so people can do it that maybe aren't in a digital setting.
Emma. Yeah, that's brilliant. Thank you very much. And you have answered the question that I was going to ask, really, around, you mentioned the sort of negative aspect of chatbots and people's experience of that, but then on the converse side, you actually identify very clearly the advantages of from clinical. I'm conscious of time, but Andy, is there anything that you wanted to ask there?
I think when we record these sessions, one of the questions we get from people who tune in or listen in is, okay, how can I contact people? I don't need your email addresses, but is it best to contact you via email or LinkedIn or what? Because very often, you know, when and I know this, you know, I've listened to someone very amazing like Joanne, and I want to make contact with her, and I don't know how to do it. So is it easier to contact you via email or LinkedIn?
So if I can just point to the QR code again, that gives the details for our Digital Mental Health Innovation Cluster webpage. Both myself and Anna's email contact address is there. We can't share directly people's email, obviously, for regulations perspective, but one of the reasons that we've created a specific LinkedIn group, which you have to join our network to access, it's specifically for digital mental health, that enables people then to link directly with the members that are in that group in a safe way, and to identify partners and people that they perhaps want to work with or collaborate with. And that is exactly what we're looking to do within this podcast, obviously, is to work, as we've said many times, beyond Scotland, beyond the UK, and learn from other partners and collaborate in funded opportunities if possible. Emma, did you want to answer? Sorry, I cut across you there. I was just shamelessly promoting the Digital Mental Health Innovation Cluster.
No, all I was going to say is I'm happy for anybody to kind of get in contact. We're always keen to kind of, I suppose, promote the kind of digital interventions and increase access to psychological therapies. Yeah,
and what I haven't actually said, a very glaringly obvious, it's free to join the Digital Mental Health Cluster, so anyone can join. And again, using the QR code, there's a Join Our Network link. That means that we can then retain information on service product or your as an academic, and then it gives you the opportunity to identify the areas that you might want to work on. And that allows us to tailor our response and communicate directly with you. So join our network is what I would say. Join the Digital Mental Health Innovation Cluster. And thank you to all of our speakers today. It's been incredibly informative, and I look forward to being able to share this with a much wider audience. I think it's been incredibly helpful. And Andy, thank you very much for asking for the podcast in the first place.
You're welcome. Nice to meet you.
Okay.